Here at Johns Hopkins Medicine,
known for groundbreaking research, teaching, and medical care.
Hello, and welcome to Johns Hopkins Children's Center Facebook Live. I'm Dr. Catherine Hoops. I'm a pediatric ICU physician and an assistant professor of anesthesiology and critical care medicine and of health policy and management at Johns Hopkins University in Baltimore, Maryland. With seemingly endless events involving gun violence, we know there's a strong need for change. For decades, we've seen the effects of numerous violence-related events, and these events take a toll on people of all ages, especially our most vulnerable members of society, our children. They are experiencing and witnessing these events firsthand, and we'll all need to have these tough conversations with them. I'm joined by my colleague, Dr. Carol Vidal, who is also a child and adolescent psychiatrist and assistant professor at Johns Hopkins University School of Medicine. Thanks so much for joining me today.
Thank you for having me to discuss this very important topic.
And thank you all for joining us today to cover this very important topic about gun violence prevention and talking to our children about these unfortunate events. If you have questions that you would like to ask, please send us a message on Facebook, and we'll try to get to as many of your questions as possible. So even within just the last month, we've seen so many tragedies involving gun violence. So we're going to discuss gun violence prevention tips, but also how parents and caregivers can talk to their kids about these events. So we'll first jump into a few questions, but remember, if you have a question, please send us a message.
I would like to ask the first question to Dr. Hoops. What efforts do you think we can focus on to overall drive down the gun violence?
Thanks so much, Dr. Vidal. I think the key message that I hope that people will take away from this is that these tragedies are not inevitable. There are so many things that we can do that we know work to prevent gun violence, from mass shootings like that in Uvalde to the daily toll of suicides and homicides in all of our communities. So more broadly, we have to all, and I mean all of us, from us as individuals examining our own biases to local, state, and federal agencies, work to address the structural and systemic inequities that result in hypersegregation, reduced economic opportunities, and increased violence in Black and Brown communities. And we have to reduce the stigma around mental health issues and improve access to mental health services everywhere, but especially in our rural communities. But focusing particularly on the firearms and reducing access to firearms as a means of violence prevention, there are three major things to focus on from my perspective. So the first is licensing or permit to purchase laws, which require prospective gun purchasers to obtain a license prior to buying a gun. This creates a system that verifies people's identities and ensures that they are not prohibited from gun ownership before they get the gun, which sounds pretty simple, right? No one who is not already prohibited from gun ownership is prevented from buying a gun. It just means that we keep guns away from people who shouldn't have them. And we have licensing systems for so many other things, like driving a car, for example, and we know that these systems work. In the case of firearms, licensing systems are associated with reduced rates of homicide, suicide, mass shootings, shootings by police, and gun diversions for crime. Second are domestic violence protective orders and extreme risk protective orders. In the case of domestic violence protective orders, lives can be saved by strengthening these laws, extending them to include dating partners, this is closing the boyfriend loophole, including temporary or emergency orders, and requiring the surrender of firearms. Extreme risk protective orders are also sometimes called red flag laws, and they're similar in that when someone is at great risk to themselves or someone else, law enforcement or family members can ask the court to separate that person from their firearms and prevent them from buying new ones. And these have shown powerful reductions in suicide especially. Third is child access prevention laws that require firearms to be stored so that children can't have access to them. We all want children to be safe from gun injuries, and we know that unsafely stored firearms, in the home increase youth risk of unintentional injuries, homicides, and suicides. Child access prevention laws reduce firearm injuries by children and youth. And I often tell gun-owning families that you can still have a gun for personal protection and safely store it in a drawer safe in your nightstand, for example. That's just another way to protect your family. So all of these policies are commonly referred to as being common sense gun safety, but I want everyone to know that they don't just stand to logic, they stand up to rigorous science. These are common sense and evidence-based ways to prevent violence.
Dr. Hoops, you started to talk about this already, but what are a few tips for parents and caregivers to safely store and secure guns?
Thanks so much for asking that question, Dr. Vidal. Every firearm should be stored, unloaded, separate from ammunition, in a locked box or with a locking device every time it is out of the immediate possession of the adult gun owner. Every gun, every time. And there's a spectrum of safe storage, with the bare minimum being keeping guns unloaded, but there is increasing degrees of protection when firearms are stored with an external locking device, such as a cable lock that can be purchased often for under $10, versus in a drawer safe secured with a numeric keypad, for example, that can be purchased for often under $50, versus in a large immovable combination wall safe. And the spectrum means that there's something that will suit everyone's needs and everyone's means to keep firearms away from children and people who aren't the intended users. So, Dr. Vidal, as a child and adolescent psychiatrist and as a mom of teens, in what ways will discussing violent events differ from speaking with younger children? So my 7-year-old asks great and really hard questions, and I'm sure many parents, similar to me, sometimes struggle with how best to respond.
Thank you for the question, Dr. Hoops. I think this is something that many parents were asking themselves after the latest school shooting, and that I'm sure many parents in urban communities where we see daily episodes of gun violence, like in Baltimore, are also starting to figure out. The main takeaway point is that the way we talk to children about gun violence depends on their age and how ready they feel to learn about the events that happen. For children in school age, the chances are that when they're in school, they will hear about shootings that are very present in the media from other children in school or in their neighborhood. That is if they don't hear it from the news when riding in the car, or on TikTok or on other social media platforms, because it has become very difficult these days to control the information that children hear. If the media coverage is wide, it is best to not delay telling them. It is always best when the parent is the one talking about it. Not talking about it can seem scarier for the child. And in that sense, we recommend to create a supportive environment where the parent is available and allows for the child to express their feelings. Parents will want to answer the questions to the child honestly and clearly, and children may also ask the question several times, and it's okay to repeat the answers. Parents should be able to also validate the child's concerns, which they will naturally have. When talking about the event, you want to take cues from the child. You can ask them what they have heard so far and how they feel about it. And one rule of thumb is just to follow what you want to answer only when they ask. So there's no need to volunteer too much information. Just answer the questions that the child is asking. And that the children are very good generally at asking what they're able to handle. And also try to listen closely, because sometimes the parent can also gently correct any information that may be inaccurate, and that will be helpful. It is also important to be reassuring and calm so that the parent can model how to modulate emotions. And then also continue routines, and doing ordinary things can also help that child just to keep their regular routine of the day. And for both adults and children, being distracted, doing things that are enjoyable and positive is good, just to not ruminate too much about the event. And in that sense, limiting media exposure is a good idea. Again, both for the child and the parent. I think it is very hard for all of us to take a step back from all the media that we're bombarded with through just a regular media and also social media. But once you've heard the news, really there's not much benefit in continuing to hear the same news over and over again. And I think one of the things that I think is most important that we tend to forget when we talk about how to talk to children is that we can also communicate that there are adults that are doing things to help the community that has been victimized recover. That we can tell them that there are people helping the families and the victims, and that there are organizations working to prevent situations like this from happening in the future. And then they can also be encouraged to find some sense of purpose or meaning in doing things for others or volunteering For example, teenagers can be encouraged to take action if they feel that that's appropriate in many different ways. And that can give them a focus and a sense of purpose and a feeling that they can change things for better. And we saw that with the survivors of the Parkland High School shooting. So, Dr. Hoops, talking about media in general, is limiting exposure to violent media beneficial to prevent gun violence?
Thanks, Dr. Vidal. I think that's such an important issue, and you started to touch on limiting media exposure some. So one study that included a comprehensive look at screen violence that was showed that children who have been exposed to over 8,000 murders and over 100,000 other acts of violence through television alone before middle school. Another study showed that in 1 year, every single G-rated movie included some kind of violence. So understanding the risks of exposure to virtual violence in terms of violent behavior, for example, is really challenging for a lot of reasons. But we do know that virtual violence exposure is associated with increased aggressive behavior and aggressive thoughts. And for that reason, it's important that parents and pediatricians should be mindful of the shows that children watch, the games they play, and the social media accounts they follow. Even cartoon violence can seem real and have detrimental effects to young children who may not always be able to distinguish fantasy from reality. So as parents, we should try to co-play or watch the programs to ensure that the content is appropriate. For example, is that program showing violence in a way that trivializes it? Or is a show displaying hateful or racist portrayal of characters? And finally, importantly, the American Academy of Pediatrics recommends that any first-person shooter game is not appropriate for children. So, Dr. Vidal, we've talked a little bit about protecting our children from exposure to virtual violence, but with the prevalence of violence in our communities and in the news, how can you help when your child is personally affected by gun violence?
Thank you for this question, Dr. Hoops. In our discussions about gun violence, we often forget the daily exposure to community gun violence that many children in some American urban areas experience. Witnessing or being a victim of gun violence is an adverse childhood experience, what we call ACEs. The ACEs are traumatic events such as experiencing physical or sexual abuse that can cause significant stress on the child. We know from previous research that the more ACEs an individual is exposed to, the worse health outcomes in their lifetime, from worse mental health outcomes to more cardiovascular disease and cancer, more damaging behaviors such as substance use problems, and even shorter lifespans. That is why after providing a safe environment, the next thing to do when a child is personally affected by gun violence is trying to identify any effects the exposure to this traumatic event may have had on the child's mental state. We also have to consider that children are affected by gun violence in many ways. Some of them are victims of gun violence, but others have lost friends or parents or other relatives to gun violence, have been part of a school shooting, or have been robbed at gunpoint. And the experiences may look different, but all of the situations can have negative consequences in children's health. And at the same time, we also know that many children experience these events without negative consequences or minimal consequences. This is why it is important to consider the child as an individual, as the reactions can vary.
Dr. Vidal, can you comment some more on how gun violence affects children's mental health?
Yes, the effects of gun violence in children can manifest in many different ways. The most common would be to just be immediately be upset about the event, as anyone would expect given the circumstances. And that is a normal reaction. Beyond that, psychiatrists have a name for the conglomerate of symptoms that also cause functional impairment, meaning that they affect the way you function in day-to-day life. And the most immediate of one of the disorders that we have is called acute stress disorder. And it's less severe and long-lasting than the better-known post-traumatic stress disorder, but has some similar symptoms in which there's avoidance of the things that remind you of the event, some sort of re-experiencing the event or being on edge all the time, which we call hyperarousal. you also want to watch out for problems with sleep and attention, anger, appetite loss, low mood, or anxiety, which for many children can manifest in school refusal, which is a refusal to attend school, which might be more likely in the case of school shootings, for example, or community violence that makes that going to school difficult for the children. And then triggers such as anniversaries or birthdays can also, or even just certain locations, can also cause the child to experience more anxiety. Sometimes children don't have the language to express all the symptoms of PTSD, but then they will show them in their behaviors and they might present more disruptive behaviors. For example, a lot of the kids that are diagnosed with ADHD have, this feeling like being fidgety or having trouble concentrating or showing more impulsivity, which are also symptoms that can happen when you have been exposed to a traumatic event. The good news is that there are interventions that work and that the medical community now is much more aware of the potential consequences and also of the interventions for traumatic experiences related to gun violence. As you, Dr. Hoops, have mentioned before, there are public health interventions that can take place before the event happens. Like many public health interventions to reduce gun violence involved effective gun legislation, but also learning how to identify people who are at risk, providing mental health and promoting mental health, and making threat assessments, making sure that children at risk do not have access to guns, which is important not only for school shootings, but also for the most frequent case of suicides and for suicide prevention. And then also creating more equal communities that provide the basics for people to live dignified lives that prevent them from getting involved in underground economies and more at risk for gun violence. Once the person has been exposed to gun violence, then there are interventions such as cognitive behavioral therapy, and for children, a specific one called trauma-focused cognitive behavioral therapy that basically helps the child deal with the trauma and avoid developmental disruption so that they can develop well. Many people also talk about traumatic growth, and I think this is my more optimistic view of exposure to trauma. It's a concept that involves coming out stronger and better from the experience that you've had. And a good visual that I like to use for my patients is this Japanese tradition of kintsugi. It's the Japanese art of repairing broken pottery by mending the areas that are broken with powder, gold, silver, or platinum, and it makes it a more beautiful pottery. And as a philosophy, it basically treats the breakage and repair as part of the history of the object rather than something to disguise. And in a way, traumatic growth is what happens when you're able to repair the damage that the trauma has caused with an end product that is even more interesting. And the trauma is basically part of your history, but it doesn't have to break you or define who you are.
Dr. Dow, thank you so much. That was such a beautiful image and kind of the perfect way to transition to our next segment. It's wonderful to talk with you as always. So glad we could do this together. So thank all of you for watching. We hope you enjoyed it. We encourage you to follow Johns Hopkins Medicine here on Facebook and other social media platforms. Johns Hopkins is committed to our children's safety. And for more helpful information, you can visit hopkinschildrens.org, at the School of Public Health, the Center for Gun Violence Solutions, as well as healthychildren.org. And of course, follow us on Facebook at Hopkins Children's.